So we still utilize protein A to capture the antibody via the Fc region. But then we saw in our development that our magnetic beads, or magnetic beads in general, they actually cope quite well with high particulated cell broth. That's how we actually try to investigate that and apply that actually into process as well, where we add the beads directly to the cell broth and capture the antibody out of that cell broth.
Hey, smart scientists! Welcome to another episode on the Smart Biotech Scientist podcast. What if you could combine the clarification and capture steps into one single step? Today, we're talking exactly about that with my guest, Nils Brechmann, who is the marketing manager at MAGic BioProcessing and the co-inventor of the process applications. MAGic BioProcessing is a biotech company from Uppsala, Sweden, that develops magnetic-based recovery of biologics. Are you juggling the complexities of CMC development while trying to enjoy the beauty of biotech? Have you ever wondered if there's a way to simplify bioprocessing? Welcome to the Smart Biotech Scientist podcast, where we're diving headfirst into the very challenges you face. We're breaking it down, demystifying the jargon, and giving you the keys to unlock your full potential. I'm your host, David Brohlman, and I get it. With 15 plus years in the biotech industry, I face the same challenges you do. There's a way to simplify and streamline so you can remove complexity, you can skip trials and errors, deliver without delay your groundbreaking therapy to clinics and market, and still enjoy every single step. Do you want to learn how industry experts and I did it? Grab a cup of coffee and your favorite notebook and pen. Now is the time to take your bioprocessing game to the next level. Let's smarten up biotech. Hey Nils, welcome to the Smart Biotech Scientist podcast.
Hi David.
So good to have you. Nils, share something that most people don't know about you.
Yeah, absolutely. First of all, thanks for having me. I'm excited to be here today with you. What I can share, I'm a very passionate scuba diver, or more like I'm really into water sports based, really. I like swimming, I like diving, I like wakeboarding. So I'm really passionate about water sports, basically.
Well, that's exciting. And how did you get into biotech? Tell us your story.
It's a long story. I'll try to shorten it a bit. Basically, the decision was early on. I had a big interest in biology and physics, which basically paved the way, more or less. Then I started my bachelor and master's in the University of Bielefeld in the area of molecular biotechnology. I did an exchange at the Royal Institute of Technology in Stockholm, halfway through my master, and more or less got stuck there. I worked in the group of Veronique Chateau, did a project work there, did my master thesis there as well, and then I stayed for a PhD in the field of downstream processing, where I looked into alternative methods that can be used for processing of various targets. That's basically how I ended up in the biotech area. For me, it was nice because I could do this project with a small startup company I'm now part of as well. I had the chance early on to be also part of one of their patent applications, where I'm a co-founder of the application for the processing of magnetic beads. That's pretty much a short version of what I've done in the last 7 to 10 years almost, actually.
Wow, fantastic. Before we zoom into the downstream processing, let's have a global view on the whole bioprocess development. Because I'm curious, Niels, what do you think are the main challenges that we as biotech scientists often face when we're developing a bioprocess?
I actually think, there are many challenges. And it depends very much on what your product is and what area in the bioprocessing you work. If you work more in the upstream related fields or more in the downstream related fields. But since we want to focus a little bit more on downstreaming today, I'll try to highlight that a little bit more. But I think eventually you can summarize it quite easily. When it comes to the upstream, of course, you want to reach as high productivity as possible. So the challenge is always to produce a high quality product And then for the downstreaming, it's actually more or less the opposite. You want to have a product which is as pure as possible. That's your main challenge. And then, of course, you have side quests as well that determine then the outcome later on as well. But then essentially for the downstreaming, you want to have a high purity, but still want to lose as little product as possible, to summarize that.
Now, we live in exciting times in the biotech industry. We have a lot new modalities. For many years, we just had MAPs. Now we have bispecifics. We have fancy molecules, fusion molecules. We have viruses, RNA, etc. What are today the most commonly used purification techniques?
Now, actually, I think we're really on the verge of getting into a new area with cells and viruses. I think that's very, very exciting. And MAPs still there as well, also with their different variations. Then we have new mRNA technology. But I think overall, of course, it's a little hard to generalize. But overall, I think all the processes, they rather look similar, actually. We start with an upstream part. Then you do some sort of harvesting, which, of course, is different depending on the product, but it's still the same sort of process. Then you have some sort of capture, some sort of polishing, and then lastly, the fill and finishing. If we want to look a little bit deeper into the actual targets, if we talk about RNA, there, of course, it depends a little bit. Some of those RNA products, they are synthesized, and some of the products, they are actually produced in cells, for example, plasmids, where they're produced in bacteria. Then that actually leads to different challenges. When we talk about, for example, plasmid or other variations of nucleic acids, where you, for example, we have to lyse the cells in order to obtain the product, that, of course, opens up all new problems for the downstreaming part, where you then have to get rid of cell wall and cell membrane. You have to get rid of other proteins, other DNA and RNA fragments. So there's a lot of impurities going on when it comes to that step. But still, you have to do clarification. You have to get rid of the solids in order to process your target, which is then still commonly done in some sort of column chromatography application. And then you have to do some sorts of buffer exchange, fill and finish in order to get your product primed for the market. For MAPs, obviously, there we have the huge advantages of having this really nice platform process, which is based on protein A, which is more or less predetermined for almost all MAP products or derivates of it, as long as they have a FC part where the protein A can bind. Because it's just so efficient, there are very little process where this is not the case. Of course, there have been very nice studies where some people used completely protein A less purification methods, which I think are nice, but then still the efficiency of protein A is it is unmatched. It is what it is. And then you have, after the protein A step, you have a couple of polishing steps, a couple of filtration and finishing steps. The restriction here obviously is that you still have to do a clarification step. You have to remove your cells. You have to make sure that you have a liquid which is free of solids in order to make sure that your columns won't clog. So this is something which we're probably going to talk about later a little bit more. But this is, of course, one of the major challenges, especially if you talk about MAP purification. When it comes to viruses, I think that is a very interesting field right now. A lot of discussions going on there, a lot of new problems emerging. First of all, of course, you find virus particle intracellular and extracellular. So you are potentially have the same challenge that you have to do some sort of cell lysis in order to obtain your full product. Then, of course, leads to the same problems that we have discussed, where you have to remove cell membrane fragments, where you have other proteins in your soup, which you have to get rid of. So you potentially actually start with something and then make it worse before you actually start to purify it. But I think all those three, they are quite similar in how the purification process is designed. Obviously, the different methods, they will be different from each other, but essentially it's about firstly removing a lot of liquid and then trying to polishing your product. When it comes to cells, that is a little bit different because obviously cells are a very complex construct. We are not dealing with just a protein or a virus. I mean, it's a living cell. And firstly, the most important part is that we try to preserve the integrity of the cell in order to have the same functionality. This must be rule number one if you want to purify cells, that you preserve the integrity and the functionality of the cell. Currently, there are very little specific methods for the purification of cells, I would say. Mostly it has to do with the fact that we are focusing a lot on autologous cell therapy, meaning that the material comes from the sick patient itself, so the risk for immune response is rather low. Therefore, the purification technology is not focusing a lot on polishing the actual product. It's more like priming it for the right conditions with different buffer exchanges or different washers, which I think, however, in the future is probably something that is going to change a little bit more, especially if we look into allogenic cell therapy that has the potential to be some sort of off-the-shelf cell therapy. And then we'll talk about larger quantities of potentially different cell types. And those different cell types, they have to be removed in order to make sure that you have only the one cell type that you want to obtain. I mean, there we are currently at a crossroad where we don't really have the technologies or the methods in order to do that, to process large quantities. I mean, we have technologies which are really, really nice for small scale. They work really well. But for large scale, we are not really there yet. And I also feel like that a lot of people have not really realized that this is going to be a problem in the future. That's something we're trying to advocate quite a lot as well, to make people understand this is going to be a problem in the future, that if you produce large quantities of cells that are going to be used as a cell therapy product, you have to make sure that your methodologies is there to do that for you.
Are we going towards completely different technologies? Because for the last few decades, we basically had chromatography and ultrafiltration in downstream process. Is there something totally new on the horizon, or are we just talking of improvements of these main unit operations?
When it comes to antibody and viruses, I think we are still sticking to the same methods and same methodologies, because I mean they have been proven to work very well in the last decades. When it comes to cells, obviously, since they are larger, we'll have some adjustments to make. Column chromatography or classic column chromatography might not be something that will work so well. Maybe, for example, monolite chromatography is something that can help out here. Membrane absorber might be something which are of interest as well. And then currently magnetic beads and then fluorescence activated cell sorting are used quite a lot, but they have the restriction that they are not able to produce large quantities of cells. So it will be exciting to see. Probably, as it always is, going to be a mixture of both. Few new technologies and few old technologies that have been adapted to that new target.
So Nils, why is clarification and the capture step still a bottleneck today in bioprocessing?
As I see it, the problem there is it's time consuming and it's mechanically challenging for the cells. Now, I'll use the example of antibodies because that's something which has been investigated quite a lot. As I see it, obviously, if you use column chromatography, you have to get rid of the cells and all your solids. There's no way around that. But then if we talk about the cell clarification, have dedicated time for the centrifugation, and then in most cases you also have additional filtration steps, which have a dedicated time as well. You have centrifugation that can reach the limits, especially when it comes to high particulated cell suspensions or cell broth. And that's something I see becomes more and more challenging, especially now that people start to move towards very high cell densities. Speaking of 100 million cells per milliliter or higher, that centrifugation actually starts to reach the limit. They're starting to be mechanically very challenging, meaning it might add another layer of released impurities to your suspension. You might have to do the centrifugation in several batches. You might have to do pre-treatment of your cell broth prior to the centrifugation in order to make sure that you actually remove all the solids. You potentially have the risk of filter clogging and fouling if you don't remove all the solids. So I think there's a lot of different factors which still makes it the bottleneck. But then, of course, in all fairness, I don't think it's the only bottleneck in the downstreaming part. Probably everything that comes after that also has a right to claim that position as well.
Let's talk about protein A for a second, because as we all know, protein A has been the gold standard for maps for a long time. It probably will continue to be the gold standard for a certain while. And you mentioned the magic word already, magnetic beads. So how can a magnetic separation change the landscape of downstream processing?
I fully agree. Protein A is here to stay. And in all fairness, I think it works wonderful. Actually, what we use on our magnetic beads as well. How our magnetic beads try to change the landscapes, that's due to the integration of the cell clarification and the capture step. So we still utilize protein A to capture the antibody via the Fc region. But then we saw in our development that our magnetic beads, or magnetic beads in general, they actually cope quite well with high particulated cell broth. That's how we actually try to investigate that and apply that actually into process as well, where we add the beads directly to the cell broth and capture the antibody out of that cell broth. And that actually gives you two advantages. You skip fully the step of cell clarification and have the capture step at the same time, while being also mechanically very gentle. That's something we have seen, and we were actually surprised when we saw that the first time, that the HCP level is very, very low after this one step of purification, where you actually are below 100 ppm already. That's something we've seen because we actually remove the steps of filtration and centrifugation, that there's just much less mechanical stress on the cells, so they don't release any additional HCPs, especially while the logarithmic reduction is the same as you would see in column chromatography A, which makes sense because it's still the same mechanism. It's still protein A that binds to the Fc region. There should not be a difference, but then the overall level at the beginning is already quite low, so you reach actually very low HCP content after the first step of purification using magnetic beads coupled with protein A.
Wow, that's massive. I mean, that's very efficient. And the fact also that you can basically skip one step, that's a huge saving in terms of manpower and organizational aspects and so on. That's huge for especially a large scale facility.
That's pretty much what we are advocating as well when we're out on conferences. I'm currently working also on an economic study together with the people from UCL, where we actually show exactly that, what the impact is for those kind of savings on your overall process that you would run for a year. That's something, at least the feedback that we got, that people are very interested to see the savings, not only in cost of goods, but you also at the same time, you increase your yield, or you actually have less loss in your overall product. And with that, you increase the throughput over a whole year of production. And I think that's something which is very worth exploring, to try to get that into more and more processes.
Hey, smart biotech scientists. I hope you have been enjoying our conversation with Nils Brechmann, who is the marketing manager at MAGic BioProcessing and co-inventor of the process applications. And we are continuing our conversation in part 2, so make sure to come back. And please let us know what you think of this episode by leaving a review, because by this we know what you think. It helps us improve what we're doing and come up with better episodes that resonate even more. And also we're going to be able to reach even more smart biotech scientists like you. And if you want to master your bioprocesses, we can help you in 3 different ways whenever you are ready. Number 1, we can help you get clarity just to get started. And this usually we do this in a few weeks or so. We can also help you craft a solid roadmap in about 90 days to give you confidence that this roadmap will lead to tremendous results. And number 3, we can help you collaborate with other industry players so you can 10x your business. If one of the 3 resonates with you, just book a free call with me using the show notes, and I see you on the call. All right, smart scientists. That's all for today on the Smart Biotech Scientist podcast. Thank you for tuning in and joining us on your journey to bioprocess mastery. If you enjoyed this episode, please leave a review on Apple Podcasts or your favorite podcast platform. By doing so, we can empower more scientists like you. For additional bioprocessing tips, visit us at smartbiotechscientist.com. Stay tuned for more inspiring biotech insights in our next episode. Until then, let's continue to smarten up biotech.